and able to record. Okay, Bismillahirrahmanirrahim. Alhamdulillah, salatu wassalamu ala Rasulillah. Assalamualaikum warahmatullahi wabarakatuh. Again. Today, actually, we are now starting to going towards the end, nearing the end, and what we have done the previous classes, we have climbed the pyramid. We have from the lowest layer to the highest layer, and we have discussed issues regarding assessment in each of the layers. And especially we link it back to the validity and reliability of the test. And I hope you now realize some of the recurrent issues that we discussed in assessment. Number one is that training is important, especially in assessment situations where we need raters, right? And even in the lowest, the nose level, once if you use essays or whatever, then you are using human raters. Therefore, you need to train them. Okay. Even when you are using MCQs, doesn't mean that you don't need to train raters, because humans construct the questions, so they need to know how to construct a good question and things like that, right? Number two, so far, I think, I hope that you realize that it's always better to combine assessment methods rather than just to rely on one specific assessment. Okay. And number three, maybe we can see that we always think how to reduce the threats to validity and things like that. Okay, so today we are going to discuss one approach to assessment in which it started off in the 2010, 2011. This idea started to be discussed, and this approach seeks to reduce or remove the side effects, the negative side effects of assessment. Okay, so in order to discuss this, first I will discuss one example of a negative effect of our approach to assessment. And then we will discuss one article in which the 2016 article, I think I first introduced this article in your this class discussing utility. But we didn't go through this. But I think it's good if we go through this as a revision as well as introduction to the idea of programmatic assessment. Okay. And after that, we have time, we will go through the model of programmatic assessment. Okay, and I hope you had the chance to go through the chapter. Ashraf, Dr. Urush, were you able to download or open the articles?
Yes.
Okay, good. All right. So if not, then we will discuss the basic things. I don't expect you to know the features of programmatic assessment in detail, but at least you know what is it and what it seeks to do. All right. And for that, let me share my screen. Okay, you can see here. All right. So I want to show to you this. What is this reductionist approach, right? And by showing you a typical, let's say this is an examination for a final year 5 exit examination. This is just an example. Okay, And this exam has two components, a theory component and a clinical component, in which the theory component is contributes 50% and the clinical component contributes 50%, okay, 100%. Right? Let's look at the theory component first. Under the theory component, you have two tests, right? Test A and test B. Okay, test A and test B. Test A contributes 40% to the 50%, and test B contributes 10% to the 50%. Okay, so far? Right. So in test A, maybe this is a multiple choice question, right? There are 100 questions from question 1, 2, 3, 4, 5 until 100. Okay, and for each question, actually, we have prepared a blueprint and we have thought about what to ask. We made sure that the questions sample all the important areas. Okay, and same with test B. Test B may be an essay. Let's say an essay. There are 6 questions altogether. 1, 2, 3, 4, 5, 6. Right. And again, we have blueprinted the question so that we know that the questions cover important areas, etc., etc. Okay, and let's say we take one student. Let's say student name is Ahmad. Ahmad takes the exam, and for test A, he got 60%. Overall, 60 over 100. So if we take 40% out of that, he gets 24% there. And then he takes the essay. Okay. He takes the essay. He gets 40%. He's not very good in essay. Okay, so he gets 4 marks there. So his theory component results is 28 out of 50. Okay. I hope I'm calculating this correctly. And then he seeks for the clinical component. Okay. And again, in the clinical component, there are two tests, test A and test B. Okay. And test A contributes 20%, test B contributes 30%. So test A may be an OSCE. So this OSCE has 10 stations, 1, 2, 3 until 10. And again, we have blueprinted everything. We make sure that it covers all the important areas, the 3 C's. Okay. And test B, maybe this is a long case. There are 2 questions, 2 cases. Okay. So Ahmad takes the test, and for the OSCE, he gets 50%. So 10 marks. Am I right? Okay, never mind. And this is just an example. You don't need to calculate the marks to make sure I was right or not. Okay. And for test B, he was good in the long case, so he got 70, and meaning he got 21 marks. Okay, so 21 plus 10, 31. So his clinical component results 31. Okay. And for overall results, he got 28 plus 31 is 59 out of 100. So he passes. All right. So far, okay?
Okay.
Okay. But what we need to realize is that when Ahmad takes the MCQ, for example, okay, when he gets the 60%, does he know out of the 100 questions which question he answered correctly, which question he didn't answer correctly? Are we as a lecturer, are we bothered that he can answer question 1, 2, 3, 4, and he cannot answer question 5, 6, and so on and so forth?
Not enough time.
Not enough time. So
Check on all students.
yes. So this information is gone. Right? We do not know, or students do not know whether he can answer the cardiovascular questions well. In the cardiovascular question, can he answer the questions on acute myocardial infarct and bacterial endocarditis, and can he answer the surgical question, whatever he doesn't know, right? At the end of the day, we are just interested to see this.
The results.
The
The number.
results, the number. Okay, and the same for the essay. This is gone. This information is gone.
The grammatical error ke.
Yes. What we want is this one.
It's
Alright.
very reductionist.
Good. Yeah, that's the point. But we reduce the information down to the one which we think is representing. We reduce the information to something which represents all the information. Okay, and even here, then will the student know he passed his MCQ or his essay, or he failed either one at the end of the day?
Only overall result.
Only overall result. So we even reduce this. Okay, and the same thing happens here. We lose this information. We lose this information, and we even lose this information. Right. Okay, and at the end of the day itself, we even lose this. Okay, we are just interested in this one.
Overall.
Isn't it? So this is what we call as the reductionist. This is not approach. This is not the fault of the system, because this is what is when we do statistics, when we take a statistical approach to exams, that is the principle, I suppose, behind statistics, is that we will take the description of, we calculate means, right? We take the median and things like that, which is to we want to summarize all the data into something which is representative, isn't it? We do not care. The approach is not to know about the individual data, but at the end of the day, how do we summarize those data? That is the approach. That is the statistical approach. It's not a fault or something. That's the thinking behind this approach. Okay. However, this means that we do lose a lot of information. We do not know actually about this particular student. Is he a good learner? What were his strengths? What were his weaknesses? Students do not also do not know this. They do not get any feedback. Okay. So this is what we call as the reductionist approach. Okay, that is one, if you can say fault. I do not know whether we can say is one fault or one weakness, or it's one feature of the usual approach to assessment, which is the assessment of learning. We want to see how well they learn, and therefore we summarize it. how competent they are. Farhana, are you following?
Farhana on and off.
Nampak. Hello. Hello. Farhana. Yeah, I think she said since yesterday there's something wrong with the Maxis.
Maybe some discussion, Doctor.
Yeah.
What if we give the results and the questions to the student,
Mm-hmm.
maybe during the holiday time, when they are free, they can look back at the thing that they've gotten wrong, and maybe they can re-answer again
Mm-hmm.
things that they want they got it wrong before, and
Alright.
they can refer back to the lecturer. Yeah, and because during holiday everything is disappear, right? I mean, when we got the result, we're
Yes.
happy. Or even after graduation, there will be 1 year to 2 years time whereby they are not working. So
Yes.
for me, if reductionist approach, at the end of the day, it doesn't really serve the purpose of a lifelong learning person.
All right. Wow,
They get
those are absolutely correct. But uh, that is what's happening, isn't it? I think from our experience as well. Even for me, after my final pro, uh, I throw everything, my notes, everything. And I don't really know my strengths and weaknesses actually regarding my clinical, myself as a graduated doctor. I do not know what were my strengths, what were my weaknesses. All I know, I passed my exams. Okay, and if we give back the questions and blah 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 blah, do you think the students will have a look at it?
I'm not sure.
If
Maybe some, maybe
Maybe
if
some
some.
not
of
relevant to their
if
works, most likely no.
Maybe if you give it this is not a final exam, maybe the examinations during the learning, which we call as the formative assessments. Maybe they will pay attention. Okay,
mm,
but then if we say this is formative assessment purely for your own learning, it doesn't contribute anything to your final marks. Again, we're talking about the behavioral impact, isn't it?
yeah,
So it's a
the
complicated
steering
thing
effect.
actually. Complicated thing to really design our assessments so that students learn according to the way we want them to learn. Okay, at least you are all thinking along the same lines. Yeah. So now we know I think we realized long ago there are side effects of assessment, right? And we always complain about our SPM, our whatever examination, national examinations. We are saying that we are exam oriented, blah 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 blah. But then this now when people start to promote this programmatic assessment, this is what they're trying to overcome. And we will have a look at one of the original proponents of this programmatic assessment, which is Van der Vleuten. He is in Maastricht University. I think I'm not sure. There another guy, Schuworth, his colleague. One of them has gone to Australia. I think working there last time. I'm not sure whether it's Vleuten or Schuworth. Anyway, if you read this, he sort of summarizes the history behind he's proposing the programmatic assessment. So if you can bear with me, we'll go through the important points in the article. Okay. So he started off by recalling the discussion on utility. Remember the article that in 2005, this one. Okay.
Remember.
And he pointed out that there were 5 distinct quality characteristics of any assessment method: reliability, validity, educational impact, acceptability, and cost. Okay, but he pointed out that that was not the main message, okay, because he says there are many other quality. All right, what he wanted to deliver in the article actually was that any single assessment method can never be perfect on all criteria. Okay, that's one. And second, in reality, assessment always involves a compromise. Compromise? I'm not sure. It involves a compromise. Okay. Good assessment involves a mindful choice about where and how to compromise. Okay, will depend on the purpose and the context. Okay, so that's what we have discussed before. I hope you all can remember this. Okay, and he said we argued that any single measurement is really no measurement. So we're talking about sampling, isn't it? You cannot just make one sample. You must make multiple samples. And what was the underlying issue regarding this sampling? Why do we need to sample a lot? Anyone recall?
To reduce the threat for reliability, to increase
Okay,
the
and why?
reliability.
And why? What's the problem if we just take one sample?
It will be content specificity, content
Yes,
specified.
yeah, that's one of the main issues: content specificity, or what's the term? Context specificity. It is specific. So one question is specific. The response, the competence is specific for that particular content, right? So, and therefore, it's related to sampling. It says any assessment, old or new, objective or subjective, standardized or unstandardized, requires at least 3 to 4 hours of testing time to achieve minimal reliability. Meaning a single method of assessment, not combined. Okay. So he says even with reliability criterion of 0.8, we should realize that 20%, because 0.8, 20% of the pass-fail decision we make may be false positives and negatives. So even if we take 0.8 reliability, it does mean that there's about 20% of the results are due to error. Okay. So, and then he said, this naturally leads to the question of when to optimize what. So that's why he says, I'm sorry, I hope you're not getting dizzy. How to optimize the collection of methods? How do we combine? And how do we combine it well? That was the question, okay? And that was when he started to think, how can we make a mindful choice of a combination of methods in which compromises are justified in light of the educational context and the purpose of the whole program. That was the initial thinking, which led to the proposal of the programmatic assessment. Okay. So far, any questions?
No.
So far, no.
So far, okay? Right.
Okay.
So he says that idea was taken well, but he says that now we have to research on assessment a bit differently. So he says previously all research was focused on individual methods. What was the reliability of the MCQ? What was the reliability of this method, that method? People didn't really look at the combination. Okay, so so he says now we have to think about coming up with research findings about how best assessment can be combined. So in this paragraph, he starts to talk about the research on combining assessments. For example, he came up with a set of education neutral design guidelines. You can look this up later. A very nice article actually. And also he published a lot of the findings of a lot of research on this, on how best to combine assessments in another article here. So you can also look this up if you want. I think later on I will also put this in the portal. Okay, these two articles.
Okay, thank you, Doctor.
All right, and oops, sorry. All right, and then he starts to explain about the idea of assessment for learning. So he says now we must design our assessment for making the students learn, not assessing what was learned, which is assessment of learning. Now assessment for learning. Okay, and he mentioned a few negative side effects of assessment of learning here, which are learners strive for grades. Sound familiar? Okay.
Yeah.
Learners ignore feedback. Learners engage in tick box exercises. And learners beat the system by playing the game. Okay. So if because for example, they know that in long cases they have to present the case, and therefore they have to impress the examiners during the presentation. So they focus on their showmanship skills, how to present well, how to impress the examiners, what words to use, and things like that. All right, so they become very good presenters, but actually some of the good presenters, they are not good clinicians. Clinically, they're not well, but because they talk well, they present well. This is what we call as the impression management. If you remember the previous class in the reading, you came across this issue of impression management. They manage the impression they make on readers. Okay. So it says many of our assessment practices are rather reductionist. This was what we discussed previously. And trivialize learning as a result. Okay. And he mentioned the most conventional approach to assessment is to have a course and end of course summative assessment. Correct? This is what we usually do. Okay. In the event of a fail, if somebody fail, we take a mindless decision, repeat the test. We don't look at what the problem is. We simply say, show us again whether you can surpass a minimum standard. Okay. If another failure ensues, what we say, repeat the course. Okay. If a learner passes, the pass is eternal, means he's forever good. Okay. If you can pass this, you pass this, you are forever a good student, right? And thus to that course and the topics covered in the learner is considered to be immune for life. There is very little information in such an assessment system about the learner. Okay, so these are his complaints, and I think for most of it, we tend to agree, isn't it? Okay. So it says assessment is basically reflects a behaviorist view, whereas in modern education is more constructivist in nature, like what you all presented previously, right? We say we would like the students to construct their own meaning, blah 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 blah. But our assessment is more of a behaviorist kind of thing. Okay, so he explains more on this, so on and so forth. So that is when he says that around 2012 he proposed the
Sorry.
yeah.
Why did he say it's more on behaviorist instead of cognitivist approach? I mean,
Constructivist.
yeah, then I
Constructivist.
mean, why it is behaviorist instead of cognitivist? Because I think if we do all the MCQ, it's all about memorization. Why? I mean, why it is not cognitivist instead?
Cognitivist. Okay. All right. You have to explain to me what is cognitivist. Because my knowledge or my understanding of what is cognitivist is quite blurry now. Can you summarize again or
Cognitivist basically they focus on how the mental process the knowledge by using maybe memorization, understanding, or
okay.
like it's like a process on using your cognitive level. I mean, how to understand things rather
Okay.
than behaviorist is maybe um, something that you have this external stimuli that
Okay.
can shape your behavior.
Uh-huh. Like the Pavlov's dog, right?
Yeah, the Pavlov thing.
Okay. So
Oh,
I
maybe he's talking about the steering effect that
yeah.
can
I was
shape
just about
the.
to say that. Okay.
Okay,
What
okay.
I think in most students, maybe not all, maybe some are very altruistic, but in most students, what's the main aim of learning?
Pass the exam lah.
To pass the exam. Yes.
Oh, yeah.
That's what he meant by behaviorist.
Okay, okay.
So the the bell is the pass exam.
Pass exam.
Okay.
Yeah, okay, okay.
Right.
No, I
Whether
get.
you learn properly or you don't learn properly or whatever, once you pass exam, you will get the food, isn't
Okay,
it?
okay.
So
I
that
get.
I think that's what I understood by his meaning. Reflects a behaviorist view of learning.
I see.
Okay.
Okay.
Okay. I hope after this you do not get a very negative view of the current way we are assessing. Huh? Uh, it works. It works.
Yeah.
And it has its strong points, and it for our purposes it is good enough. Okay, but what we are thinking and what he is proposing is that we need to realign and rethink what are our purposes of exams.
Mm-hmm.
Okay, that's all. So I hope after this class you don't be very critical, very bitter, very negative about. But because I think if not all, most of our practices are still the assessment of learning kind of assessment. Huh? Okay, but at least we know what is programmatic assessment and what is the thinking behind it, and something that maybe we can, if not take all, we take some of the features. Huh? Okay, so this is where he started to explain that sometime in 2012, he proposed this programmatic assessment. What were the main features? One is that any assessment is seen as but one data point. So based on one data point, you cannot make decisions. Pass-fail decisions are decoupled, meaning detached, removed from individual data points. Okay. Each data point is maximally informative to the learner and is information rich, meaning we give back the information to the students. Decisions are taken on the basis of many data points, meaning you look at his performance over the years, all the data, all the assessments, and make a decision, not just one final end of the course exam like that. Okay. Learners are required to self-analyze and are mentored as they do so. Wow, this sounds like a very idealistic, isn't it? Okay. However, it is done in certain places, especially in his own institution in Maastricht. The number of data points are proportional to the importance of the decision. High-stake decisions are taken on many data points. After this, I will show you his diagram, which is quite nice. Quite nice in explaining what he means. This information should tell a story about the learner. That's what we saw just now when we use the reductionist approach. All the story goes. Remember? For most learners, this story will make progression decisions easy, but for some, the story is less clear and a decision requires either much deliberation or the collection of further data points. We all know of our friends who are, they are good students, but sometimes they do not learn in the normal way, what we can say the normal way that others learn. They learn a bit different, things like that. They are good, but so this is what he's saying, that we get each individual student's strengths and weaknesses and story and then make a decision. Sometimes some students, they just cannot follow the normal way. They learn on their own style. We know that they are good, but in exams somehow they don't do well because maybe they're not. We all know people like that, right? At least I know a few of my friends. When during exams they usually don't do well, but after they graduate, alhamdulillah, they were able to graduate. They become very excellent doctors. Okay. So he himself said, although this model is well received, it is difficult to implement. It requires a cultural change in the people, in the raters, in the lecturers, and things like that. Okay, so I think that's all. That's the message in the article. So now I think up to now we know of some of the problems of the old paradigm, or not the old, the current, or one paradigm, which is assessment of learning, right? Assessment of learning, which now he is proposing assessment for learning. Okay, and before I go to the next, to show you the diagram, any questions?
Doctor, maybe what I understand from assessment for the program, usually for assessment, if let's say we have this input, process, and output, just a very simple way of telling, explaining on learning. Maybe assessment of learning is the assessment of the outcome, the output. But
Yes.
what he's proposing is also the assessment should also, for the process itself, should be an assessment for it, because we should give marks to students who work hard as well. But at the end of the day, maybe they are not good in exam, but they work hard. They show their interest.
Yes.
The working part also, we should put a value. Put a credit for the work hard. Yeah.
And how do we do that?
Yeah, that is something that I'm looking for lah.
Okay.
I also don't have the
So
how we can do that.
So
Yeah.
that means we also take into consideration their attitudes, their motivation, and things like that, right? Okay.
But
Maybe
something more like qualitative assessment.
qualitative. All right. So something's coming out there. More than that, when he says the word for, assessment for learning, it means the assessment is the one which makes the student learn. So we use it for steering. So it is one issue that we have to know actually which students are working hard, which students are just at the surface, but at the same time, the student, we want that due to the assessment program which we have designed, students say, oh, in this case, I have to study in this way, which that way is the one which actually we want. We want them to think about their learning. We want them to reflect. We want them to apply knowledge. So the assessment must be designed so there is during to do the assessment they must apply. To do the assessment they must reflect. To do the assessment, that's why that's what it means, assessment for learning. Okay, good. But you have some points. You must. We are now looking at qualitative methods. Any other things? And Farhana, Dr. Urush, maybe you want to add?
So far now. For us in Malaysia, Dr. Fuad, do we have any like framework or example of how do they do the self-analyze thing just now for the student?
Self-analysis? What do you mean by self-analysis?
Just now, if we used assessment for learning, right? So they more let the students to construct their own journey. So one of the example, is the self-analyze.
Okay.
Practically in practical, how do they do this?
Practical, good question. Let me continue first. Then maybe you can get some ideas. Okay. What was the word you used just now? On their own pace, right? Construct their own learning at their own pace. One of the features. Never mind. We will go first, right?
Okay.
This is the article in 2012. Where's the year here? There. Where he first talked about this programmatic assessment. Okay. See, these are all the Dutch people. Leuten, Schuwerth, Duysen. I don't know how to pronounce even their names. They are from Maastricht. Yeah. Okay, let's just go on. You can read this, blah, 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 a lot of words. He talks about principles of assessment, right? Any single assessment data point is flawed. A few principles there. However, what I'm interested in is this. This one. Okay. This is what he proposed as a model for programmatic assessment. Of course, the actual implementation might be a bit different, but this is what he proposed. So you have a curriculum. In which this is the beginning. You start here and you go the study until you have the final evaluation, right? So you have period 1, period 2, period 3, might be semester 1, semester 2, or maybe this is year 1, year 2, whatever, right? So this is the time.
Okay, there's internet problem, Farhana and Dr. Uruj.
All right. Okay. We will wait.
It's very important.
I'm okay. Just now ni, at the beginning. Now okay.
Apa Dr. Urus?
But I cannot see Dr. Fuad and Dr. Ashraf. Suddenly got
Can you see the iPad?
can see iPad, can hear your voice.
I can see you, but I cannot see Dr. Urush. She's gone.
Yeah, the tourist is here.
Do we continue or what? I
Maybe
think we
2
continue.
minutes.
2 minutes.
It's
Okay.
okay, it's recorded. Yeah, recorded.
Yeah, it's recorded. All right. Okay, so she's back, I think. Okay, so this is the curriculum and this is time. Okay. So we can block our curriculum into periods, right? Semester or whatever. So what he's proposing in each period, there are training activities, there are assessment activities, and there are supporting activities. Okay. So training activities can be whatever, PBL, this one, PBL, or maybe clinical session, ward session, what else? Maybe even lectures, go to the skills lab, writing, whatever. Okay, these are the activities, the learning tasks. Okay. So for each learning task, he says there will be artifact. It will produce something tangible to show that they have gone through the training activity. For example, if they go to the skills lab, maybe the artifact will be a logbook which states that they have done this procedure, they have practiced this kind of skill, whatever. So a logbook can be an artifact. Okay, so what else? Artifact. Maybe if they go for a field visit, a presentation is an artifact of pictures, photographs, presentation. Okay, so you understand the concept of artifact?
Yeah.
Something tangible produced from a learning activity. Okay. Like when you go for like archaeology, you dig up something, you find the traces of things, like we call this artifact. We find the pots and pans, we find the jewelry inside the tomb. So these are the tangible things left from the previous people's activities, right? So that's what we call as artifacts. Okay. So when we also have assessment activities, these are assessment activities, single assessment data points. Okay, so what's important here is that there are many assessment points throughout the course. Maybe this is one MCQ, this is one feedback session, this is one essay, all kinds of assessment, but we look at it as a single data point. All assessments are data points, right? We don't, and what he said just now, we don't make a decision just based on one single one, but we look at the whole thing. Okay. And these assessments even can be single certification data point for mastery tasks. For example, if we want them to, all students must pass the skills lab assessment for certain skills. For example, blood pressure taking. all students must pass the blood pressure taking assessment in the skills lab. So that is also included. Right? Otherwise, all the assessment data points are considered as part of the whole scheme of assessment. Okay. And he also says that apart from training and assessment, there are also supporting activities in which learners reflect, but they are also supported by mentors. Okay, social interaction around reflection, supervision, intervision, whatever. Don't ask me what is intervision. I'm not so sure. Okay. I think if you read, if I read the article again, I'll find it there. But never mind. So to answer Ashraf's point, how do we know the attitude of students, the individual stories, the individual approaches and things like that is from here? Because if I observe in Maastricht, it's very supervisor intensive. All students have supervisors.
It's like mentoring, is it?
Yes, all students have mentors or supervisors or whatever, right? So these activities, this kind of activities, they have meetings with the supervisors where they discuss the reflection log, reflective diaries and things like that. The supervisors give feedback on each of the. So it's very heavy on mentoring.
I see.
That's where they get the feedback.
But then, let's say in UiTM,
Uh-huh.
they in MindUST, they have this mentoring, but I don't see it's very functioning, whereby they
Okay.
put like one student under orthopedic, one student under. It's like a random mentoring, but how can we do this like a reflection on maybe in pediatrics, but the supervisor maybe in orthopedic. So
Yes.
the supervisor cannot give.
From what I understand, you all please go through this article and the other article which I from what I understand, the mentors stay with the student for a long time, so they get to know. They get to know the students. Okay. So even though they are not in pediatrics, but then they are able to advise in terms of the overall the learning, the feedback, etc. And at the end of the day, how are they assessed? This is intermediate, maybe after one semester or maybe after at the end of the year, whatever. The intermediate, the evaluation is done by a committee who then looks at all of this and the artifacts. They look at the artifacts, they look at the assessment activities as a whole, and they get feedback from the mentors. The mentors play a very big role in giving feedback regarding their students. So based on all this evidence, then they make a decision. Okay, decision, maybe the student can progress or whatever. So these assessments, individual assessments, are formative, but they believe that if you have enough formative assessments throughout the year, you can combine it and make a summative decision.
Summative decision, yes.
Yes. So now the summative and formative becomes a bit blurred. They feel that if you have enough, the keyword is enough. You have enough formative information sessions, you can make a summative decision on the candidates. All right. So they make sure that the committee, the supervisors are not involved in the committee. or maybe for different students, different people will be in the committee. So that's how, and they repeat the same thing again here. And maybe at the final evaluation, they will see again all the information, all the assessment artifacts, all the reflection activities, and they make that final decision. But I'm sure in this kind of feedback heavy method, any student who is having problems, let's say attitude problems or learning problems, they would have the information early on. Early in the year, early in the course, they know already, I have this problem, and the school, the faculty also knows the student has the problem. So there is no reason that students at the end here, then only they say we need to fail you, because it's very feedback heavy. So students would have prior warning about his problem early on in the course. No such thing as final year, fail, have to go out. Okay, this sounds very, you say, boleh ke? Can we do this? But apparently in Maastricht they have started the many years now using this kind of curriculum, and of course they do research on it. They give and if you are interested, you can look up the literature regarding programmatic assessment, especially in Maastricht. I'm sure there is a lot of administration problems and things like that, but this is the idea behind it. Okay. Okay. Any questions? Yeah.
Yeah. For example, right, this one mainly is a combination of formative and summative, right? But do we do a specific test as a summative, for example, during the intermediate evaluation end of semester? Do we still do that, or we rely solely?
If you want to do here, one of these might be like the traditional semester exam, with your MCQ and your essay, whatever. But it is one of the assessment, not the only assessment. There are a lot of other things they take into consideration.
Okay.
Understand.
Okay.
Doctor,
I think
just to relate, just to relate to my child's school, whereby it's a school that does not sit for the what you call the national exam, UPSR. So and they rely heavily on this assessment activities and training activities, and also have the self-assessment for kids. So but they are not that in terms of systematically, because they just introduced this in the curriculum.
I
So
see.
I'm not so sure how can we like compare our school. I mean, the student in the school compare with other schools, or if let's say they want to enter boarding school. I mean, if they don't sit for a standard UPSR, and let's say I want to send to overseas, so how can this assessment be accepted in other international, I mean, other places, to accept my son, so that they are actually this kind of my son has reached this certain of competency and able to study there, because this is very specific. I mean,
because usually they will look at, for example, O levels.
Yeah.
They will look at A levels.
Yeah.
Right. So this is the language in people use for, especially for transferring and going there, going here, right? So that's there's always the challenge because we are not speaking the same language.
Yeah.
But I suppose for this programmatic assessment, his advantage is that these guys, they are very well known.
Mm.
Van der Vleuten, Schuworth, what's his name? Vleuten, Schuworth. These are all the so-called the big names in assessment. So they have this advantage of influence. So I'm not saying that this is good all the time. Sometimes you see that because they control, they sort of like the controlling, and usually these people also are involved. They have the journals, right? Association of Assessment in ASME, they have medical education. The journal, the American Association for Medical Education have JAMA, Journal of American Medical Association, medical, which is the big article in medical education as well. You go and see. So what I'm trying to say is that whoever controls the journals also control what is seen as the trend.
Trending, yeah. Okay.
So whoever wants to be in the trend must follow them. So I'm not saying that whatever we are discussing is 100% true. We must abandon what we do and follow this 100%, whatever. We must always be what we call as a healthy skeptic. Right? So as an example, one of your seniors, Dr. Khadijah, she's from UPM. She got a grant and to do her sabbatical in Maastricht, where Vleuten is.
Wow.
So she did her master thesis, master project, comparing and doing a qualitative review on the students from her university, which is UPM, and Maastricht, who is doing the programmatic assessment. Yes, and surprisingly, the students there also mentioned that it causes stress. Because they have to do a lot of write-ups, fill in the journals. They have to. So even they say sometimes they feel it's too much. So even when you do programmatic assessment, you can still get carried away, and also cause stress to students. But I'm not sure whether it's good stress or bad stress. And also it is one qualitative study which is she hasn't been able to publish yet. But just to say that in any kind of system, there will be side effects, pros and cons. Yeah. So this system looks good. Has a lot of positive factors, but the thing is, people say we do not adopt, but we adapt. So we must know the strengths and weaknesses of all the systems, and then we take the best out of all of this. So yeah, what in this article I just wanted to show the diagram, and also this, which what Ashraf was saying. So they are also saying that potential assessment strategies related to qualitative research methodologies. Okay, so if you can see their assessment which they are proposing, they can no longer use the same theories like validity, reliability in the old way. But they're saying even in qualitative research, we still have principles such as credibility, transferability, dependability, and so on and so forth. Okay. Excuse me for a while.
Okay.
Oh. Yes, saya. Kat mana dah tu? Kat mana? Oh, okey lagi. Kalau mas arah nak ke Binjai tu, nak daripada Kementerian tu, lepas istana tu dekat lepas je istana tu masuk ke kanan, pagar istana tu, lepas pada masjid, ada masjid istana kan? Ada kedai Jayayu tu, masuk lorong ke kanan. Lepas tu jumpa sipai mula-mula ke kiri. Masuk tu. Rumah saya tu agak ke tengah sikit. Kalau masuk tu kiri kanan rumah tikar. Rumah saya rumah 2 tikar mula-mula sekali alik kiri. Ya. Dia cat warna biru. Apa ni? Homestay tu pangkal lagi. Ni masuk tengah sikit lagi. Ya. Kiri. Sikit lagi. Sebenarnya ada sipai pula tu. Rumah saya di situ lah. Dekat tu. Ya. Ada orang di rumah. Okay, sama. Alright. I'm sorry. Hello, can you guys hear?
Yeah.
Boleh.
Okay. Sorry lah, ada orang nak hantar barang.
Delivery. Dato' Fuad, Dato' blackout. No electric. So she cannot join.
Okay. Fine. Tak apa-apa, kita record Okay. Wah, saya kena delete lah saya punya phone call tu daripada record. Okay, so what we're saying is that even though we are not using the old, or maybe not to say not using, we are because of the new so-called like a new approach, we are doing more like a qualitative approach, right? But qualitative approach also has its principles: credibility, transferability, dependability, all these TTTs, right? So you have the criteria: prolonged engagement. So the supervisor must be with the candidates for a long time. Triangulation. So whatever the supervisor say must be triangulated with other methods. Peer examination. All right, member checking, structural coherence, time sampling, tick description, and audit. So these are the criteria for the strategies to establish trustworthiness. So not to say that is something new, is already there. The principles are already there. And so they outline potential assessment strategies, train assessors, so on and so forth. Right? So in terms of the theory basis, they are quite solid, right? But the implementation wise, I think we can have a look in the literature. They have been doing this since 2012. Now it's 2020. I'm sure a lot of literature already there in terms of programmatic assessment. Okay, so any other questions or thoughts or anything? Any sharing? Sounds like interesting school. Your son.
Akademi Bakat kan, MBS.
Yeah.
Apa namanya? Akademi Bakat.
Akademi Bakat, yeah. And they have this mentoring from the business person itself, where this is for
Alright.
the macam form 1 lah. Form 1 they have to set their own BMC. BMC is business model canvas, where they have to like a framework on what they want to do business on something. So after the business model, they've done the business model canvas, that business model canvas will be scrutinized by a business person, saying that this is the something that you need to add. And after that, by graduation, they have to start a business by themselves. Whether it's online, whether it's technology. So if they want to do technology, then the teacher will liaise with somebody, let's say for coding. So they have the people liaise that teach some student for coding according to the business that they constructed on Form 1. So by Form 5, they Form 4 or Form 5, they already have their own business.
Okay. Alright.
Understood.
Thank you very much for the nice discussion and sharing of ideas. See you all tomorrow, inshallah.
Okay, thank you so much, Taufan.
Assalamualaikum warahmatullahi wabarakatuh.